Good morning. My name is Deborah Berger, Deborah-Burger. I've been a registered nurse for 46 years in Sonoma County, and I'm president of National Nurses United and also president of the California Nurses Association. I'm going to read a statement from one of our quarantine nurses who works at a Northern California Kaiser facility. She chose to share her experience anonymously, but she is hoping that her story can be elevated to raise public awareness about concerns for the coronavirus response. She said, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick in quarantine after caring for a patient who tested positive. I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. I volunteered to be on the care team for this patient who we knew was positive. I did this because of all the recommended protective gear and training from the employer I thought was being provided. I did this assuming that if something happened to me, of course I would be cared for. Then, what was a small concern after a few days for caring for this patient became my reality. I started getting sick. When employee health told me that my fever and other symptoms fit the criteria for the potential coronavirus, I was put on a 14-day self-quarantine. Since the criteria was met, the testing would be done, and my doctor ordered the test through the county. The county officer called me, verified my symptoms, and agreed with testing. But the national CDC would not initiate the test. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of the health of this country. Later, they called back, and now it's an issue with something called the identifier number. They claim they prioritize running samples by illness severity and that there are only so many to give out each day, so I have to wait in line for the results. This is not a ticket dispenser at the deli counter. It's a public health emergency. I'm a registered nurse, and I need to know if I'm positive before going back to care for patients. I'm appalled at the level of bureaucracy that's preventing nurses from getting tested. This is a healthcare decision my doctor and my county health department agree with. Delaying this test puts the whole community at risk.